Let's dive right in. So here we have a 48-year-old woman brought to the emergency department, and she's found unconscious in her bathroom. She's got a history of untreated hypertension. She was complaining of the worst headache of her life before collapsing. That should make us think of something I'll tell you in a second. And non-contrast head CT reveals diffuse hyperdensities and yada, 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 yada. A repeat CT scan shows no new hemorrhage. Okay, they're really helping us out here with a lot of this diagnosis stuff. But what we really need to know with this question stem is we've got a brain bleed. It's called a subarachnoid hemorrhage. That's the worst headache of your life. It's a burst aneurysm, and a few days later, she gets weak on one side. And then there's a sign of a stroke, not because of more bleeding, but because the blood vessels in her brain have clamped down. There's a vasospasm, and that is being irritated by the original bleed. And so the most common complication of subarachnoid hemorrhages happens like between days 3 to 12. With 5 to 7 days being the most typical time. And the best medication to prevent this is called Nimodipine. Here it is. Boom. See that below? All right, so these are our answer choices right here. And how this works is we get a calcium channel blocker. That's how Nimodipine works. And it mostly works on the brain blood vessels, and it keeps the blood flowing in the brain and protects the brain from damage. And so other drugs like labetalol and ACE inhibitors will prevent or can help like blood pressure, but they wouldn't stop the vasospasm. And mannitol and nitroglycerin might even make things worse by increasing the pressure in the brain. So Nimodipine is like this guardian for the brain and blood vessels after brain bleed. It's used to prevent a stroke, and it stops the vessels from tightening way, way, way too much. So there's this woman with her SAH, subarachnoid hemorrhage. The weakness, that's how you know the worst headache of your life, subarachnoid, just to make you think of that. And the calcium channel blocker called Nimodipine helps the vessels stay open and prevents the brain damage. And so yeah, labetalol, this is kind of cool. Let's just go through each of these, just explaining what they're going to be tested on for the step. So this is going to be used acutely to lower blood pressure and in the setting of SAH to prevent the rebleeding. And that rebleeding would usually occur like within the first 24 hours. It has no role in preventing delayed vasospasm though, so that's not going to be it. Nalopril, that's an ACE inhibitor. It reduces your BP, so it lowers BP, but it would not prevent your vasospasm. And so they have limited use in SAH settings because of the it can change and it can cause drops in the cerebral perfusion pressure. Mannitol. So this little guy here, mannitol, is an osmotic diuretic, and that reduces the intracranial pressure, especially in cerebral edema. And it does not prevent your vasospasm, which will lead to ischemia. And a clonidine, how about this guy? This is a central alpha-2 agonist for chronic hypertension. All right, that's used in central, or rather, the role actually doesn't have any role in vasospasms or anything like that. It's just using chronic hypertension. So clonidine, that's pretty much all you need to know about clonidine, alpha-2 agonist. And nitroglycerin. All right, so nitroglycerin, that's going to be like a vasodilator, and it increases the intracranial pressure, and that can actually worsen your edema. So it can actually cause edema. You've seen the sketchy, it's got like the elephant feet, the peripheral edema in the feet and stuff. It's just no good. Also increased bleeding risk. So no, you do not want to use that. Hydrochlorothiazide, that's used for long-term blood pressure control, and it's not going to be effective at all in this situation. So not appropriate for this acute scenario. But yeah, so SAH, give them this. Give them one of those, right? Because how it works is it promotes the vasodilation of the cerebral vessels. It will reduce the calcium-dependent excitotoxicity in the neurons, and it'll improve the functional outcomes for the patient. So yeah, it just helps. It prevents the ischemia and neurological deficits due to the vasospasms that happen after SAH. And yeah, we're on day 6 or so. So hopefully this helps with the patient in some future date. Here it is. Look at this nice little box. Yeah, that's a nice little box. It looks like it belongs in like the Stanley Parable, or like toothpaste goes inside of it. I digress. We'll see you in the next video.